Moving day is tough enough for the average family, but what if your new home has about 400 rooms, cost upwards of $285 million, and you're moving several hundred family members? Well, it helps to have 6 years to plan the move, a veritable fleet of moving vehicles ready to roll, and a legion of volunteers lined up to help. In 2006, Lee Memorial Health Systems acquired the assets of the Hospital Corporation of America. The package included a new hospital that was being built at Daniels and Metro Parkways in Fort Myers to replace the Southwest Regional Medical Center and merge it with the smaller Gulf Coast Hospital. The sheer logistics of moving an entire hospital are staggering, requiring years of painstaking planning and preparation.
I've been with the Southwest and Gulf Coast facilities for almost 6 years, and just coincidentally about the same time that I got here is when it was really in the design process. So with regard to designing the facility and getting staffing plans consolidated with the leadership team and the equipment lists and all those things that go into design, between 5 and 6 years it's been planned.
As workers were putting the finishing touches on the new state-of-the-art Gulf Coast Medical Center, officials began assembling their teams to coordinate the move. An integral component in those plans was a dedicated corps of volunteer workers. Between them, Southwest and Gulf Coast had about 500 people who donate their time to provide a multitude of services, excluding direct patient care. That is left to the medical professionals.
They are intertwined throughout the whole hospital. They're in every department, every unit. They're in the OR, ER. They take care of some businesses for the auxiliaries, such as the popcorn, book stand. We have a thrift store, and going into the new facility, we will also have a gift shop and uniform shop.
Over the weeks leading up to Moving Day, March 8th, some 30 volunteers received special training to make sure the families of relocated patients weren't lost in the shuffle.
Starting January the 9th, Alex Greenwood has been training these volunteers. He's been taking them every Friday from 9 to 11, going through the new facility, gearing up for employee tours, VIP tours, and employee tours, community tours as well.
They register in admitting and registration, which is behind the information desk, and then all waiting is here for surgery, for imaging, radiology, cath lab, as opposed to Southwest. When you go to Southwest, there's waiting rooms all over the place. Since the planning of the patient move and how we're going to activate the new building, we've attempted to use every bullet we have in the holster, okay? And a core part of our team when we're trying to take care of patients is volunteers. And volunteers have stepped up to the plate. They've made themselves very available to us, and they've said, whatever you need from us, we want to help.
Hospital officials said those volunteers would play a key role in making sure that the families of patients were involved in the moving process and not just told to come back another day after things had settled down.
Not at all. On the day of the move, we will have the family members in this community room. Once the patients are transported over to the new facility and they're up in their unit and they're comfortable, then we will personally escort the family members up to their loved ones.
When Southwest opened in 1974 as Fort Myers Community Hospital, it was seen as an alternative to the badly overcrowded Lee Memorial Hospital. But what do you do with a large, vacant, once proud medical facility that has, in effect, outlived its usefulness? When the dust has settled from the move, Southwest will likely be closed and eventually torn down. Moving an entire hospital was more than just a logistical and medical challenge. It served up a prime opportunity to test and hone the skills of Southwest Florida's emergency responders. Officials said sheriffs, fire, and police departments from across the region were teamed up with at least 7 emergency medical services in an exercise in cooperation, coordination, and readiness. The move was made easier by the fact that almost all new equipment and furnishings had been purchased and were already in place.
The new facility is fabulous. There's lots of room, and Everything is up to date. Very nice.
The model behind the planning of a typical patient floor in this facility is a decentralized model with the idea of keeping patient care, nurses at the bedside. If it's from the computer to the substation on the wing, the 12 beds on the wing for the whole nursing team to take care of 12 patients in 12 private patient rooms, the focus has been to keep patient care at the bedside.
As moving day approached, the level of anxiety rose, but so did the confidence level.
Moving the whole hospital is a daunting challenge. I'm a little bit nervous, but we have lots of good help.
And while the ambulances were being fueled up, that corps of volunteers readied itself for the big day.
They are very excited. I can say they've taken ownership. They're very proud of the facility. I have volunteers that have been here for 25 years, and they're very excited about the move.
But won't a new hospital also mean more volunteers are needed?
Absolutely. We're always looking for volunteers. We try to, work around their schedule. We have very active seniors, so we work around their schedule and what their likes and dislikes are. So we don't, we try to make it an enjoyable experience for them.
I would recommend volunteering here because it's been so rewarding to meet the people and to be able to do something nice for people that are in need at the time, and you go home feeling really, really good.
In the healthcare universe, volunteers are the unsung heroes. Unpaid and largely unknown, they go quietly about their business, making life easier for medical professionals, hospital staff, and, most important, patients and their families. But on this day, they rose to the occasion as polished performers in an astonishingly intricate ballet of movement and humanity.
It was great. There were all the nurses, everybody was on deck. I was down in the emergency room, and people were looking for things because they were in different areas, but they all were very calm, and all the patients were taken care of very well. It was impressive the way they all worked together. People really worked together.
I guess I am just inspired by them. I am proud to be part of this team of volunteers that we have. They're just a great bunch of people, and I feel like I have one of the best jobs in the whole world. I really enjoy it.